Hello and welcome to another episode of Educational. This is Roy.
This is Terry.
So this podcast chronicles our journey. Not only I will say my journey through aging. Terry is always timeless. She hasn't aged in years.
I have him trained.
And then and also our parents. You know, we are dealing more and more. We just are in the midst of a move with my parents. And Terry's had some, her father, she lost to Alzheimer's a few years ago. And then her mother is doing well, but, you know, we still have the challenges with payers, programs, and different things like that. Also, we like to have guests from different disciplines on, and today is no different. Dr. Robert's going to be with us, and I'll let Terry introduce him.
Dr. Robert Yoho is our guest today. He is 67 years young. He practiced medicine in the United States and retired 2 years ago. He was a board-certified emergency physician and later a board-certified cosmetic surgeon. He did breast enhancement, liposuction, and facial procedures. He's recently published 2 books, Butchered by Healthcare and Hormone Secrets, and calls himself a healthcare whistleblower. Dr. Yoho, welcome to the show. We're happy to have you today.
Thank you, Terry.
Yeah, thanks so much for taking time out of your day. I mean, we got, you know, there's a lot to talk about. I think we want to really focus on the hormones, but we'd like for, you know, can you just give us a brief overview of the whistleblower book?
Okay, so this is my other book, Butchered by Healthcare. It's the first one I wrote. And it tells the story. Everyone in America knows that our healthcare system is broken. It's obvious, but nobody understands quite why. And we're like a person describing an elephant. Somebody's got their hand on the tail, somebody's got the hand on the little toenail, and somebody's got the hand on the trunk. So we even the medical specialties understand there are things wrong. Some of the internists, for example, know pretty well that the cardiologists are doing a lot of stuff that isn't well supported by science. To put the kindest spin on it and to put the worst spin on it, they're doing a lot of stuff for money that doesn't work, right? So the bottom line with healthcare in America is we showered money out of the sky onto this industry to the point where we're paying twice per person what any other developed country pays. And there are many, many academics that think 50% of what we do is either ineffective or actually injurious, right? So we've got a mess on our hands, and everybody understands that when they go in to see their doctors, they find that the doctors are looking at their computers. They're required to spend literally 25 to 50% of their time documenting things on their computer. I mean, that's the figure. And I know it's hard to believe, but that's literally true if you look it up.
Yeah.
So I wrote this book after examining one field after another, and I thought I was going to uncover a little can of worms, but what I uncovered was a dumpster full of worms. I mean, it's a mess from the start to the finish. The insurance companies clip 20 to 25% off the entire roughly $4 trillion gross revenues of healthcare. I mean, it's amazing. They administrate the whole thing. The pharmaceutical companies, they give up billions of dollars every year in criminal federal prosecutor settlements. And that makes them, by that measure, the most criminal industry in history. I mean, it's an unbelievable thing. And so they have, over the last 20 years, they have openly ruined most of the science behind their studies that they're required to produce in order to get their drugs approved and patented. We have a patent system that allows profiteering like you wouldn't believe it. When the corporate interests found out how much money there was to be made in healthcare, it attracted entrepreneurs, and worse, it attracted the crooks. Yeah. And so that's what we're seeing in healthcare. We have a system that is so heavily influenced and ruined by money that even the doctors who have the best training in the room, we cannot keep our heads screwed on tight. We have fields like oncology that have over half of their income is produced by retailing drugs that are outrageously expensive, that cost $100,000 or more a year. We have, I mean, it's a crazy scene, and almost every specialty field has things that they're doing that are absolutely wrong-headed, is well documented. Nothing I say is original. It's all derivative of literature that's out for anyone to look for and look at if they want to. But interestingly, what I did for most of my career, and people ask me, how did I become a healthcare whistleblower if I was a cosmetic surgeon? Surely that's the happiest thing imaginable. Yeah. Well, it was a great career. And, you know, you get to deal with women, and that has its great and its questionable side, easy, right?
Easy.
Sometimes I characterize it, I said it was like having, you know, 500 girlfriends, any one of which could get mad at you at any given time.
Oh my gosh.
Did I say that, Terry?
And then they found out about each other. And
yeah, they found out about each other. Well, there's something happened. Yeah. But they're not happy all the time together. But anyway, so I had a couple of fatalities in my clinic within a 5-month period. And, you know, cosmetic surgeons are not supposed to have fatalities. We typically have a fatality every career, right? Once a career, something happens, and there's always some sort of special problem or some crazy thing. But I had 2, and one of them was another surgeon operating in my facility, but it still was very painful. So it led me to re-examine everything I was doing. And I got interested in general medicine, and somehow I bumbled into this corruption thing, what I eventually decided to call corruption, medical corruption. And it's ubiquitous. I mean, it's an amazing thing. But for most of my career, I also had a very happy practice. I prescribed hormones. And I never could figure out why hormones were so run down by everyone. I mean, there's all these stories about cancer and heart disease and strokes and all this crazy stuff. And after I wrote my corruption book, that Butchered by Healthcare, I wrote another book that is called Hormone Secrets, and you can see it right there. And this picture of this is a mask, and a Mexican mask, and it's got the names of the hormones on the mask. And that's supposed to represent the complexity going inside of Terry's head. Did I say that, Terry? It's true. Women are complicated. They're hormonally driven. And we all know that. Men are hormonally driven too.
I was going to say men too.
Yeah, of course they are. And but men experience a more gradual slide than women. Women hit a stone wall when they're 50, you know, called the menopause. And it's a very difficult time. And many of them consider it existential problems or situational problems, but really you can prevent and treat most of it by just supplemental hormones. So I'm going to go in, as you guys develop this interview, I'm going to go into how the various influences made up a bunch of stories about hormones and that are essentially untrue, and how healthy they are and how important they are especially for seniors. And I don't think either of you guys are on hormones, are you?
No.
Okay, well, then just of a particular interest for you.
Yes, it'll be very educational.
That mask is I'm looking more and more like that mask all the time.
Well, that mask is not just women who are over 50. That mask is all women. So It's a complicated thing. Anyway, go ahead.
Oh, I was just going to say that, you know, I hear more and more about men my age being low on testosterone, and that it can help in so many ways, you know, with maintaining a better weight and energy and different things like that. So that's why I'm very interested to hear more about this, because it's just something I've never really thought about going out and getting tested for.
Go ahead, Terry.
I was going to ask, when should women and men, when should they go in for a hormone panel? Does everybody need to do that at one time or another, or on a regular basis? How do you know when you're
hormones should be a part of general primary care? And there are many indications for hormones for younger women who, especially women who've had hysterectomies, who's had ovarian failure, and testosterone is dropping in our whole society in men. It's a phenomenal thing, and the sperm counts are dropping. Nobody knows why. It may be, that we're getting discouraged, or it may be that there are toxic chemicals, or maybe something about the high sugar diet or something, but it's a phenomenon over many decades. And testosterone replacement can treat many of these symptoms, although it does render a person infertile. The men are infertile after several years, and also their huevos shrink. which is permanent. You know, well, if you care about that, you better forget about testosterone therapy. But testosterone is the second most important hormone after estrogen. And since testosterone is broken down to estrogen, it supplies a source of estrogen for both men and women, who both should get testosterone over a certain age, because their testosterone levels drop so far.
Yeah.
At what age? About age
Okay,
range?
so 50 is generally considered. I think anyone should be screened at 50, although some men maintain high hormone levels into their 60s. I think it's reasonable. The main thing is, do you have symptoms? Are you tired? Do you feel not as sharp? Do you feel anxious? All those things are treated with testosterone therapy. And Roy mentioned one of the stunning things about testosterone. The studies we have over a decade show continuous weight loss. So it's a better weight loss drug than anything we've ever had. The other drugs we tend to put people on and off of them. Testosterone is, if you want the benefits, you want to continue taking the drugs, and you want to continue taking the rest of the hormones.
Okay.
There are many, many benefits to all this stuff.
And I think the other thing too is the kind of want to mention that the limits, because I think a lot of these things get bad raps because somebody abuses them and takes 10 times as much, or, that's being a little bit.
No, that's exactly accurate.
But, they take.
No, it's not theatrical.
Okay.
The starting bodybuilder dose is roughly, for a man, is roughly 1,000 milligrams a day, 1,000 milligrams a week. And the standard replacement dose is 200 milligrams a week for everyone else.
Oh.
So now, it is true that there is some limit that causes problems, but these drugs are much safer than you can ever imagine. The bodybuilders don't freaking fall over with heart disease and all kinds of problems routinely. They have some problems, but they're not well characterized and not well known.
Yeah. Well, because a lot of the other drugs that they push, or that they used to push, basically where they were just forms of what we used to call speed in the old days. They were just something to kind of speed up your heart rate,
caffeine pills.
Yeah. Things like that.
Well, they take drugs to make themselves lose weight. They sometimes take thyroid. They take amphetamines, like the kids with the Adderall and all that stuff. So, and those things are actually moderately harmful. And certainly if abused long-term, they're harmful. Those are not hormones. Thyroid's a hormone, but the Adderall class drugs are not hormones. They're 100-year-old drugs. We understand a lot about the problems with them. The best observers, in my opinion, are backing off the recommendations that we have to universally medicate our young people in school. But we got a third of the kids in Ivy League schools are taking those damn things. I mean, it's just, It's awful. And the animal studies show brain shrinkage. I mean, they're not good for you.
Yeah.
They can certainly aid short-term performance.
Yeah. So the other thing that you hear a lot about, or I've heard a lot about lately with this conversation, is that I guess there's like a plant derivative or something, that there's a chemical reactions, things that you can buy over the counter that may or may not be effective. They may or may not work. Can you speak to that as well?
Sure. Now, the Goldacre quote about, because there are problems with aircraft design, it doesn't mean magic carpets fly, right? Did I tell you that one before?
Yeah.
That applies here. And there's nothing that's over the counter that does a thing. Okay, so forget about that. Okay. You actually need to replace the actual hormones, the bioidentical or natural hormones, the same substances that you had when you were younger in larger quantity in your body. Those need to be replaced. And we have relatively inexpensive ways to do that have not been able to patent these things. So they're relatively inexpensive through compounding pharmacies, which make drugs for individual patients. You don't have to buy. Now, some of these things are patented because the patent drug manufacturers are allowed to patent drugs for at individual doses, but that means nothing. I really would stay away from those. They're good quality through a patent drug company, but they're outrageously expensive, and their claims to unique qualities are incorrect.
Okay. So basically, what we need to do is go to a healthcare professional, and I guess they come as a prescription, or is it an injection or a pill, or how are they usually delivered?
Okay, so we have the main three hormones for women are progesterone, estrogen, or estradiol, which is the natural main one. And the progesterone is a natural progesterone and not Provera. Provera is a chemical synthesized progesterone that causes various problems, and testosterone. And testosterone there are multiple ways that we deliver these things, but generally speaking, if you want to try to remember one thing about the delivery systems, the creams don't work well except for testosterone. Okay, a woman can take 3 times a week, can take a little smear of testosterone and get all kinds of great effects from it. But if she uses cream, estrogen, or progesterone, she's likely to have to apply it 3 times a day to get levels that are high enough. Your blood levels are everything. And there are nutritionists and other people with agendas that are trying to tout salivary levels because they can get a hold of these salivary testing and profitably retail it for their patients. But it doesn't work very well. It just doesn't reflect exactly what the blood levels are, which are the bottom line for how good your health is. And I go into why and how that all works in Hormone Secrets with the crazy girl in the front.
So if somebody went and got the started taking them, how long would you expect to go before you see some marked results?
A week to a month. And then you'll get, I mean, the studies on the weight loss, they telescope out over 10 years. It's amazing. Some of these things like human growth hormone, which, I mean, it's been rendered almost politically impossible to prescribe. And if you are courageous enough to prescribe it, it's outrageously expensive. Those human growth hormone can take 3 months to have a subjective change in how you feel. And some people don't feel it very much. But it could be the best hormone of all. We have all these freaking hormones. We have 50 to 100 years worth of experience with them. Just think about that. How many drugs can you say that we have 50 to 100? Certainly not Prozac, certainly not any of these antidepressants, certainly no psych drug, none of the modern chemotherapy drugs, nothing do we have 50 to 100 years experience with. Now, the Big Pharma has not done double-blind controlled placebo trials on hormones because it's not profitable. They can't charge $25 a pill or thousands of dollars a month for them because they can't be patented because they're human body components, except for in these certain circumstances like special doses, or they can patent a patch, which is a delivery system that goes on a woman's skin or a man's skin in order to deliver the hormone. But we have generic compounded variants of these things that mostly come in pill form that work very well. The testosterone needs to go through your skin or injectable. The injectable is very inexpensive. For a woman, it's $1 or $2 a week. That's it. And many people use that as a surrogate for the entire hormone panel. If you want to do something simple, Terry, inject yourself with 1/10 to 2/10 of a cc of testosterone cypionate, 200 milligrams per cc once a week, and you will relieve 80% of your menopausal symptoms and feel much more alert. Your sexuality will improve, and your bones and your muscles will show signs of that make them look like you're 20 years younger. And so, and the men, it's $10 to $15 a week. It's inexpensive if you're willing to inject yourself, and it's not as hard as it seems. And in my book, I've got QR codes that you can scan with your camera. See the QR code? So you can scan that with your camera, and you can watch a video about how to do various things. I don't think I have an injection video, but it shows the syringes, and it also has patient testimonials, which are great.
Okay. So what are some, oh, go ahead.
No, I was going to say, gosh, I wish I had talked to you about 10 years ago.
No. It's not too late, Terry.
Not too late.
No, not a bit. Not a bit. It'll make a difference. Now, the data we have, if women start at 50, right, when they're hitting menopause, it is true that we have stronger data for women starting at 50, and it seems to prevent estradiol administration from then on, seems to prevent Alzheimer's. And some studies say it prevents 80% plus of the Alzheimer's. So it's a stunning thing. I have 500 references as links in this book, but for the Alzheimer's, I put in an appendix because it's such an important subject and we're ignoring it completely. We are using medications that just hardly work at all. And even the researchers will say that these 10 Alzheimer's medicines that cost thousands of dollars a month are hardly worth it. They barely do anything. And you know, there's a rule of thumb that I always use in evaluating medical studies, especially in the last 20 years when the things have gotten so fouled up. If there are small numbers or controversy, you might as well just forget the whole thing. I mean, it means that it doesn't work because whoever has studied it has studied tens of thousands of patients. And if the numbers are so small that they have to portray it as a slightly statistically significant figure, it means it doesn't work. It means it probably wouldn't be replicated if they took 10,000 patients and did it again. I mean, it's outrageous what's going on because these drug companies have been allowed to essentially ruin their own studies by either concealing. They like the human papillomavirus vaccine, they concealed 50% of the studies. Japan completely abandoned that, right? Because they understood they were so screwed up. I think we went over that in the other podcast, so we can hit the hormones a little harder.
Well, and I was going to say, I mean, you know, my dad had a long battle with Alzheimer's, 12, 14 years that we know of, that he was diagnosed, and it was a few years before that. Mom kind of hit it, we just, chalked it up to aging. And it ended up being, it actually wasn't Alzheimer's, it was dementia, Pick's disease. But that is a real fear of mine. That's what my destiny is, and I know I shouldn't do that. And I'm trying to eat right and get the proper nutrition that I need to feed my brain, and the omega-3, 6, 9 oils and things like that. That I should have done a long time ago when I was bulletproof, younger, but didn't do. But I wanted to ask you about the new Alzheimer. I want to digress a little bit and talk about the new Alzheimer's drug. What do you think about that? Is it Aduhelm? I can't say it. I can spell it.
This is the latest thing that they're marketing. And I'm not an expert about it. I don't have specifics about it, but my cynicism about pharmaceutical companies is so deep that I have tremendous doubts whether this will be anything but another freaking settlement for false claims and marketing outside of the indications, right? Yeah. So all the whole pack of those. Now, I don't want to claim that. Let me just back up a second. Obviously, there are miracles in medicine, and we see them. We have friends that have had cancer that have had some new therapy, but most of it or half of it is absolutely sales pitch to make more money. I mean, it's just crazy how adulterated the whole scene has become. And in particular, cancer therapy, it's 2 months of improved survival is what they are predicting for 95+% of those cancers. 2 months for all those chemotherapy side effects and everything else, just not worth it. We have about 5 or 6 clinical diseases that can actually be cured in cancer, and the rest of it's just nonsensical. It's just crazy.
Yeah, for the misery you go through, and it's a personal decision, so I don't want to project to everyone, but I will say, thinking about that when you said it, it's like, wow, going through all of that misery, you'd rather try to live out your last few months as happy as you can, because I know some of those treatments for different types of cancers can be very torturous.
Terry, I'm blocking on what your last question was. Go ahead and run that by me again.
Aduhelm, Alzheimer's drug.
But the thing I was going to say was, once a horse is out of the barn, Alzheimer's is very difficult to treat. I mean, you're just not going to reverse it by starting estradiol then. But had your father started testosterone when he became deficient, this might have been at age 50, he would have decreased his chances of getting Alzheimer's significantly. And so, I mean, who knows what would have happened, but remember, testosterone gets broken down to estrogen. Young men have very high estradiol levels, and the idea that estrogen is a female hormone is a meat-headed bodybuilder's idea that's absolutely wrong. Young men have estradiol levels that are just about as high as women's. Yeah. They're like 80 or 90 or something like that, and women's vary up into the hundreds depending on the menstrual cycle, but they're,
because I've heard that speaking to that, I've heard that if you do testosterone, that there's some kind of estrogen that has to be woven in there, or you kind of get a little bit of both of them. Is that correct?
You get a lot of estrogen because it gets broken down to estrogen.
Okay.
Now, testosterone, this is part of the story about how industry has ruined the narrative, right? And exactly who's responsible, I can't really point to any dirty players, but the deal is they want to promote things that are patentable and highly profitable, and testosterone is neither. Right. So testosterone, there was a couple of studies that looked through the wrong end of the microscope, telescope. They looked at testosterone from the standpoint of view. They found some people with heart disease, and then they tried to find people who were also taking testosterone. I mean, it's a crazy way to do a study. It got swept up into the FDA somehow. The FDA, which is almost a creature of big pharma because their revenues are well over half user fees that pharma pays them directly, right? They put what's called a black box on testosterone. That's an aftermarket warning of severe problems. It's completely wrong. I mean, it's outrageous. There are black box warnings on estrogen and progesterone also, based on a study that cost almost $1 billion, called the Women's Health Initiative Study, which has been dissected many times by commentators. And the thing, there was, in my opinion, it did much more harm than good. And they studied drugs that were obsolete the day the study was published. And now we use bioidentical drugs that are much safer. So, I mean, it's a crazy scientific scene, and it has been since the turn of the century. Basically, that's when kind of pharma came out of the closet and told us that they were going to do anything they wanted. In the last 18 months, it's been much more obvious to even lay observers.
Yeah.
Can you define what you talk about
bioidentical
Can you
means,
define that?
Yeah, bioidentical means it's actually a physical component of the human body. Okay, as opposed to the estrogen made from horse mare's urine, right? Premarin, or Provera, which is a chemical related to progesterone. They're not the same. And in the Women's Health Initiative study, those substances were found to be injurious in a small number. And I mean a small number. They're much better than nothing. But since we have the new ones, they should never be used long-term. There are short-term indications for both of them. I mean, they can stop uterine bleeding very effectively. I mean, they're powerful estrogenic and progestogenic agents. But for long-term use, they're outmoded. And the debate still seems to center about whether we should be using horse mare's urine for women like Terry instead of bioidentical natural estrogen and progesterone. Yeah, I know. It's crazy. That's how the deceptions get carried through in the public narrative. I mean, the studies get done that studied the wrong thing, or the studies get done that were essentially ruined, and the narratives get perpetrated by the regulatory agencies, and the doctors get fooled. I mean, doctors are doing something that's completely consuming, and they don't have time to read or do anything but like pat the next patient on the back and try to figure out what the billing code is.
Yeah.
Right.
So we kind of, I don't think we talked a little bit about some individual things, but overall, what are some of the other big areas that the hormones can help with, because like we talked a little bit about weight, maybe weight management, Alzheimer's, but are there some other big things? Because one thing it kind of sounds like is that some of these studies are trying to disprove the $1 a dose solution because they can sell you 10 other medications that cost $20 a piece.
Okay, so there's a lot of things, and I'll just go through them in a list. People hate to make longevity claims because in order to study humans, you got to take a bunch of humans, wait till a bunch of them die, and put half of them on the drug and half of them. So you can't do that conveniently with people. You can do it easily with rats. And the critics always say, well, you can't really say these are longevity drugs. But low levels of thyroid, growth hormone, estrogen, testosterone, and DHEA are linked to premature death, right? So you can say that for sure. The people who are older with low levels of hormones die sooner. And I'm certain it's vitamin D as well. Vitamin D is not a vitamin, it's a hormone. And it's an easy over-the-counter thing to do. And a lot of people respond dramatically to it. And they, the suggested doses are in my book. And it's an easy thing to correct. It's inexpensive. We don't have studies that study groups of people until they die on vitamin D either. The studies we have, see if you can figure this out. We have these Swedish studies that looked at 250,000 people. That's a lot of people. And they checked the vitamin D levels on the older people with and without diseases, right? And the ones with diseases who were older, who were doing poorly, had very low vitamin D levels. So that doesn't prove that giving vitamin D improves your health, but it's very suggestive. So it doesn't cost much, and it probably decreases your susceptibility to severe variants of COVID. That's been speculated. Okay, so general health, long-term estrogen replacement. Estrogen's the best one, Terry.
Okay.
It decreases strokes, blood clots, colon cancer, diabetes, macular degeneration. It reduces the loss of tooth. It reduces the likelihood of tooth loss, depression, osteoporosis, and death because of bone fracture. Breast cancer is unaffected, contrary to common opinion. Avoidance of estrogen in a Yale study was estimated to cause 50,000 excess deaths over 10 years in the United States. Wow. Alzheimer's disease, we mentioned. Heart disease, 40 observational studies have shown that giving estrogen to women reduces coronary artery disease, heart attacks, and deaths. When men have higher levels of estrogen, they have less heart disease, and giving natural estrogen deficient men improves cholesterol, but does not increase blood clotting, as is claimed. Depression. Estrogen, DHEA, progesterone, testosterone, and melatonin all have antidepressant effects. Thyroid has been studied and used for 50 years as a treatment for depression by the psychiatrists. Obesity, thyroid, estrogen, testosterone. Testosterone is the big one. DHEA and human growth hormone reduce unhealthy belly fat. As you may know, having a pot belly is much worse than being a little fat all over because it seems to be associated with heart disease. So those are the things. And it's a stunning thing about how much evidence there is that these things do a lot of good and how they've been suppressed. And I can go over how they've been suppressed if you want to know some political details, but
yeah, sure,
tell me what you're interested in, Roy.
Yeah, no, that'll be fine, because that's what I was just sitting here thinking is it's not anything that either one of us have ever heard or talked about. Correct,
It's
Terry?
very sick.
Yeah. I mean,
Yeah.
I have hypothyroidism, so I'm very interested in the thyroid, the basics and all of that. So if we could cover a little bit of that.
So thyroid, I would advise that you look carefully at my book, which is the best summary. And then if you want to just flip to a website, there's stopthisThyroidInsanity.com. I think that's what it's called, but that'll take you to it. And thyroid is sort of one of the more complicated stories. So thyroid, there's two different kinds of thyroid hormone, right? T3 and T4. Have you heard of that? Mm-hmm. So T4 is Synthroid. It's biosynthesized. Synthroid is the brand name. It's off patent now. T3, there are several names for that if you buy the chemical one. But the great thing is we have something that's been used for 120 years that has both the T3 and T4 in it that is not as widely used as it should be and is run down by industry. It's called porcine thyroid, like Armour Thyroid is the best known brand, right? So the endocrinologists are the experts at glandular diseases. They study for many years about this stuff, and in theory, they're the best sources of information, but they tend to be very conservative. Thyroid disease, there's another group of doctors that I call the hormone doctors. They are specialized, like I did, in prescribing hormones for deficiency states. And it's a really feel-good specialty because you get dramatic responses. I mean, you change people's lives every freaking day. And the thyroid is theorized to be deficient in 40% of the women over 40. Now, that's a big number. I know it's crazy, but the endocrinologists are exceedingly conservative about prescribing thyroid. And in a few sentences, here's why. They deal with a disease called Graves' disease, which is 2 to 3% of the population. It's a very common disease. Now, in Graves' disease, the thyroid kind of goes crazy and produces its own thyroid, right? So you can't shut it off by stopping the medicine. Okay, if you're prescribing thyroid to somebody, if they have palpitations or their heart's going too fast or they feel hyper, you just cut the dose or stop the medicine. It's easy. But in Graves' disease, you need to give medications. It takes months to get it under control. The people need a lot of monitoring. So they've had these experiences which have prejudiced them against giving thyroid, and they fear osteoporosis and atrial fibrillation, which actually there's almost no documentation that occurs with supplemental thyroid. It only happens in Graves' disease, right? So it's a bit of a, and of course, endocrinologists, they want to maintain, they don't have a chemotherapy and they don't have a surgery and they don't have some magic trick where they can bill a lot of money. So they got to keep control of their patients and maintain. Okay. So they use, there's a test they use, which is a very difficult test to use called the TSH, thyroid stimulating hormone. Okay, now this may be too much detail for you, and you can get all this in my reference, but TSH probably shouldn't be used at all because it's not an active hormone. It's just, it goes up when the thyroid goes up and goes down when the thyroid goes down. It's a brain hormone and not it doesn't have any effect on the periphery, where the thyroid is the master hormone. It has effect on every part of your body. So if you just measure the T3 and the T4 and you adjust those to high normal ranges and you look at the patient and you get them feeling good without having a rapid heart rate, that's where you should be for thyroid, and not worry so much about the osteoporosis and atrial fibrillation, because it doesn't really happen except in Graves' disease, as far as I can tell. So that's the thing in a nutshell. It's more complex than other fields. Sometimes you can find, and you got to go back multiple times to the doctor, at least talk to him on the phone or see how you're doing. But the ideal thyroid dose is not in the middle of the testing range, as the endocrinologists seem to think. It's usually high normal. It's like you're getting an A on the test instead of a C, right? The testing ranges are, they're made to be a bell curve, and the endocrinologists like to see in the middle of the bell curve. That's fine for a lot of tests, but for thyroid, especially in older people whose bodies are not as responsive to thyroid hormone, you need to push that up a little bit in order to feel your best. And women do very well with thyroid, and I've seen an awful lot of women in their 80s, and I say, what's your freaking secret? Why are you doing so well? Why are you so alert? And the only thing they did differently was they've been on thyroid for decades. Right. So, but I recommend you consider all these things, become knowledgeable about them. You can find your doctor through one of these organizations that I quoted in Hormone Secrets. And, and I've even got a couple of specific recommendations. I can't make specific recommendations, but I had a couple of people that I worked with in the course of the manuscript that you can check them out.
Okay. Yeah, because that's, I just marked down that for a question was, if you go to your general practitioner, is this something that he's going to want to talk about, or do we need to probably seek out a hormonal specialist?
Well, some of the GPs, some of the older GPs have more experience and more knowledge about thyroid because they practiced before all this craziness went in about, the crazy thyroid testing and everything else. But you got to find an older one. You got to find one who's confident and willing to do it. These hormone specialists, in my view, are the best. But I would learn it all myself if I were you, and figure it all out and know if your doctor is stepping off the rails. And you can do that with my book. You can, every detail that you have to know is in there practically, I mean, you'll never get a feel for what it's like to treat hundreds or thousands of these patients and watch them all. If you can find somebody, the other thing you can do is you can often consult with these guys virtually. You don't have to go in and see him anymore because Trump made an executive order that said that was permissible. Prior to this, the medical boards sanctioned doctors who just did consultations without being in person. They said it was not a good faith exam. But now in this era of, internet and COVID and everything else, we're allowed to do it. So I think that's another tip. If you live in a major metropolitan area, you can find these people that are part of these organizations that are very competent, and they will help you. But you've got to know it yourself, or you'll get freaking swindled.
Yeah.
You have to understand what you're looking for and know the tests and everything else. It's not that hard.
Yeah.
It's not that hard. The thyroid thing, just work on that website. You'll understand how crazy it is.
Okay.
And look at my material. Go ahead.
I'm not sure if it was you or if I heard this somewhere else this last week, that where you can go to look up all of these different scientific study, the trials, the groups and things like that. It's like, is it MedPub or
PubMed is the big,
Yeah.
that's the big, supposedly scientific thing. But you gotta realize that the studies are designed to create patent approval, right? And they're paid for, 95% are paid for by the corporations that will profit from the patent approval. This is called a conflict of interest. That's a kind way to put it. And it basically ruins they basically ruin their studies, and they do it in in many ways, including statistical frauds, to hiding half the studies, which they're allowed to do. And, using contract research groups overseas who are paid to create a certain kind of result. If they don't get that result, they get fired and they use some other bunch of jackasses next time. I mean, you read Ben Goldacre's book, Bad Pharma, if you want to learn about that. And it's a horrifying story. That's a 10-year-old book too. Go ahead.
They just manipulate the studies.
They manipulate the studies. So Getcha, who is a commentator and a statistician in Sweden, and in my view, the most reliable commentator about all this stuff, he says that it's impossible to find decent studies in amongst all the garbage now for the last 20 years. I mean, it's amazing. The system, which was very well intentioned to force these guys to do scientific studies, morphed into a basically fraudulent activity. And there's every study you read has some sort of bias. Sometimes you can decipher it, sometimes you can't. But doctors' experience means more than you can imagine. And the doctors they worship on the altar of the double-blind controlled trial, right? But they're no longer any good. And we have 50 to 100 years experience with these hormones, 50 to 100 years experience. It's more experience than any other drugs. And since they're part of our biologic systems, we know how they work because the glands have been worked out, and we know the way the drugs go around in the body and what they do. Yeah. And it wasn't apparent until recently that they had all these positive effects, but it's quite apparent now.
Okay. Yeah, good. We'll check that out, because especially with Terry and her thyroid, that may be the answer that she's been looking for.
That's the first step.
Yeah.
Yeah, definitely. And estrogen. I mean, for that matter, I need to do all of it. And I feel like I'm kind of like everybody else, where they just go in to see the doctor, and we've been conditioned just to take the doctor's word for it. And that's, you did this test and this is what it showed, so we're going to throw this medication at it. Well, we need to do a little more research and find out more natural ways to address whichever situation we're in.
Yeah. If you get through this thing, which is not hard, it's written down to about a 9th grade level, you'll know more than 98% of the physicians, at least 95%. I mean, oh, wow. Everybody's got an opinion, like everybody's got a backside, yeah. And these guys are well trained. We're really the most ethical and the best trained people in the country in some ways, but a lot of us, medicine is so consuming that only a freaking genius who's a hypermanic son of a gun can ever continue to keep up on the studies. There's like 5,000 articles in primary care published every day. I mean, it's just insane. You just can't, you can't possibly keep up. And you can become a specialist in one of these areas like hormone therapy if you try, but that's about the best you can do.
Yeah.
Yeah, you just have to try to sift through the noise.
The noise is massive.
It really is.
And I don't want to, from my inexperience, I don't want to belabor one thing that I do know about, but I think it's worth saying as a great example of, again, we've been trained to think testing is good, and that if the FDA says it's good, then it's done everything. But what, as Terry has taken more control over her knowledge of medical situations, it's like with this new Alzheimer's drug, there were 10, Terry, you tell the story.
There were 11 panel members that they were
all paid off.
Well,
They're all industry.
but they were
shills.
the ones, they
They
were the
all-
honorary medical advisory board, and 10 of the 11 said no, this drug is no good, and the 11th one said uncertain, and then
They still approved it.
the FDA used their special approval process for the first
Yeah.
time, and 3 to 4 of the advisory board members quit immediately. They were just like, hey, I mean, I know the FDA it's a whole big ordeal anyway, and it just seemed to me that they were manipulating what they wanted. They manipulated that process to say what they thought it needed to say to get the drug approved,
Remember the rule of thumb. If it's controversial, it doesn't work.
Controversial. I
Forget
am,
it.
that is ingrained into my head now.
Forget it.
Yeah. And that, again, that drug, $56,000 a year there.
Yeah.
So that, it just, I'm not, we don't even have to say that anything was when you say, that there is any shenanigans going on behind the scenes, but things like this really make it hard to believe there's not, when there's so much money to gain. But the other part of this is there's so many people that are desperate for an answer that they would do anything and they would pay anything. And
Cancer
that's
patients are like that.
Yeah. And that's where I feel like it's a little bit taking advantage of people, because, there seems to be a lot of evidence now that this is not going to work as advertised. But if it was me or my loved one, you're willing to try anything. So anyway.
Especially if somebody else is paying for it.
Right.
Well, right. If somebody else is going to pay for it, for sure. But I mean, if you have a loved one who has Alzheimer's, and you're going to be grasping at every straw that you possibly can to see, there just aren't as many drugs available, and the studies and all of it. They can't do the studies until the person dies, and they look at the brain, and there are just so many things.
It's too late for them, Terry. Worry about yourself.
That's right. That's right.
All right, Dr. Robert. Well, as always, we appreciate your time, and we're going to go do some checking out on this hormone therapy for both of us and kind of see, where we stand with that. Because I have no idea. Like I said, it's never been anything in my years that anybody's ever put on the radar that sounds like it could be, a fairly simple fix if you do need it.
Well, the American College of Gynecology says that you do not have to check blood levels for postmenopausal women before starting them on supplemental estrogens, right? Estrogen and progesterone and testosterone. So I think the standard should be the same for the men, but everybody checks the levels. I'm just from looking at you, I'm sure you benefit. I guess your level is 200, right? That was what mine was when I was 45. I don't know what happened to me, but I've been on testosterone ever since, and it's been very helpful. I'm 67.
Yeah. No, I have no idea what mine is. I need to go get it checked and see. Cause like I said, nobody's ever mentioned, hey, maybe we need to look at that. So, all right. Well, thanks so much. Tell us again, both books, so we can, people can run out and get those, and how they can reach out and get a hold of you as well.
Okay. So my website is robertyohoauthor.com. The first book is Butchered by Healthcare, right? See all that gold bar? That's how we got butchered, right? And the second book is Hormone Secrets, and it's got the pretty picture on the front. This one was just published about a month ago. And so you can get them all on Amazon, or it's getting on as hardcovers on other platforms too.
Okay. Awesome. Well, again, Robert, thanks so much. We appreciate it.
Thank you so much.
Nice talking to you, Terry.
Okay.
Roy. Okay.
All right. That's going to do it for another episode of Educational. We do appreciate all of y'all listening. You can find us, of course, at www.educational.com. We're on all the major podcast platforms, iTunes, Stitcher, Google, Spotify. If we're not on one that you listen to, reach out. I'd be glad to add to make it easier for you to listen. Also, you can find us on all the major social media platforms. Typically, we hang out on Instagram a little more. Reach out. We'd love to interact with you over there. This a video of this interview will go up when the episode goes live. So reach out to our YouTube channel and take a look at that, as well as a lot of our past interviews as well. Until next time, take care of yourself and take care of your health.